Good morning, viewers of Dementia Discussions. It is a bright and sunny November 27th at London Fields, and I'm in the City and Hackney Carers Centre with Emma Higgins, who is head of the Dementia Department at Homerton Hospital. Did I get that right?
Almost, kind of. I'm the lead nurse for dementia at Homerton Hospital.
And we've just met, and this isn't breakfast TV, it's Dementia Discussions, but we do have our caffeine, and we've got our flower pot, and we're ready to talk about maintaining, in brackets, brain health. So maintaining health, but also relating to the brain, because dementia has a great impact on the brain. So can we talk about the brain, though? Tell me things about the brain that I maybe didn't know. I don't know a lot about it, but I do have one.
So the brain is a very important organ in the body, and it's responsible for many, many functions. Things can easily go wrong with it. Memory is one of those. I think we should focus on that because there's so much to talk about. But essentially, there's lots we can do to keep healthy. People worry about dementia now. They worry about their memory. It's the biggest killer of women over 50 now in this country. So there's things we can do. I'd like to focus on the positive things. But essentially, your question, the brain is a very, very important organ.
And with memory, I know that I play all sorts of memory games all the time, just to keep it going and keep it ticking over and testing it. And I guess that's not a bad thing to be doing.
No, it's definitely not a bad thing to be doing. I mean, if we think about all the research now, everything is sort of overwhelmingly pointing at keeping our brains active, keeping socially active as well, and not being isolated. But yes, crosswords, puzzles, anything like that is really important to do.
Okay, thank you. So we have, per usual, a list, not a huge list, but a really good list of questions that people have sent in, possibly you, one of you, that deal with certain issues that our expert today will be able to answer to the best of her ability. Number 1. My wife was diagnosed with dementia a few months back, and luckily she has been accepting of her diagnosis, and to date I haven't noticed too much of a decline in her thinking and memory. I was wondering, is there anything that we could do to help delay further memory decline? So, crosswords, I mean, we talked about some things, but what other things? What serious?
So that's a really good question, and it's probably the first thing people ask when they get a diagnosis, what can I do to help improve things? I think, from my experience, there are options, basically. We can put things into drug treatments, into chemical therapies, and into non-drug treatments as well. So there are some drugs available for people, particularly with Alzheimer's disease, which is one of the big common types of dementia that people get. There are these drugs called cholinesterase inhibitors. It's a bit of a mouthy word, apologies for that. I try not to use too many long words. But essentially, there are 3 types of drugs that can be used in Alzheimer's with people with sort of mild to moderate stages of Alzheimer's. And these may help with things like memory, thinking skills, maybe your activities of daily living. Some people report some difference with that. Others don't, but some do. And then if you have other types of dementia, like a vascular dementia, then there aren't specifically any drug treatments for that, but to try and improve things like memory and functioning, then focus would be on things like diet, some lifestyle changes, exercise, and if you have things like diabetes and hypertension, that those are being well managed. In terms of non-drug treatments to help improve memory, there are things like, this is another long word, apologies viewers, cognitive stimulation therapy, which essentially activities to improve thinking. Cognition means thinking in a basic way. And usually these activities are quite fun as well, sort of games and activities to do. So they kind of come with a twofold thing, so helping to improve cognition, your thinking, but also a bit of fun as well, sort of improving well-being as well. Again, some people say that there is some improvement with their memory. They may feel a bit more sharp. There may be some improvement in their activities of daily living, but some people don't always report an improvement, but people usually say they've had a good time after these cognitive stimulation therapies. So that bit's really important, because well-being is really important to maintaining good brain health.
And you mentioned lifestyle changes. Can you say a bit more about that?
Sure. So things like exercise, we can't underestimate the importance of exercise. I mean, for any mental health condition and dementia in particular.
And why is that? Why is moving the body good for the brain?
It's really important. People with dementia can be prone to things like more falls, so maybe not recognising a danger or an object, a trip hazard, for example, becoming frail. It's really important to keep up strength exercises as we get older. But exercise is good in lots of other ways. It can release lots of endorphins, so these are feel-good hormones that make people feel good. I think we're coming on to a question about depression later on, but I'd like to sort of talk more about that then. But exercise, whatever's happening, but it releases lots of endorphins. It's a feel-good thing. It's good for bone strength. It's good for dexterity. All sorts of things. We can't underestimate the importance of it. People with dementia are also prone to sort of anxiety and depression, particularly around the time of diagnosis. So exercise is understandably, exercise is a great treatment for people with mood disorders as well. So I think we're going to get to that bit later on. I think we've got a question around that.
And we were talking, Emma and I, about dance, because I find, because I do dance, and I'm learning dance routines and whatnot, and I find those, the discipline of having to learn patterned movement and timing and all that, and rhythm is, I know that it's doing, I can feel it. I don't need an expert or a scientist or anybody to say this is really good for me, because I can feel it. And I think other things are happening in, synapses and whatever the words are in the brain whenever you go through things like that.
Yeah, exactly. You don't need the expert. I think anybody that's been for a good walk, done some dance, done a bit of, moving around, you'll know that you feel better afterwards. I mean, you're right. You don't need an expert to tell you that. But exercise is key for everything.
All right, thank you. So, 2. This is a really short one. Are there certain foods, diets, that can help brain health and prevent dementia? Very simple question. What can you eat? Now, before you answer that, I remember celery and tuna are supposed to be good for the brain. That is what popular magazine writing told me. Yeah.
So there's so much that's been written and researched about different food types, but what the experts, and I'm not classing myself in that, but if you pull all the real experts together, everybody is endorsing, a proper, well-balanced diet, but leaning towards a Mediterranean style type diet. So that will mean diets that are rich in oily fish. That's maybe where your tuna comes from.
I mean fish.
Lots of fibre and protein as well. It's really important to maintain good cardiovascular health in dementia as well, particularly if you're predisposed to things like vascular dementia. So a good steer away from saturated fats is sensible. And
what are saturated fats?
So your very sort of old-fashioned lard. Do you know? Are you American, Canadian?
I'm born in America.
Yeah. So I don't know what you call lard over there.
Lard.
Okay. I thought you had another word for it. Heavy saturated fats, cream, heavy dairy products, things that are laced with fats. They're okay in moderation, and for people that aren't really eating anything, we might encourage people to have things that are heavy in fat. But for a well-balanced diet, they're okay in absolute moderation, but not to sort of go crazy. On that note as well, just a quick quick mention of alcohol as well in terms of a diet. There's lots written about, oh well, a few drinks are good for you a week, and you know, people get quite muddled about what's good and what isn't. But the evidence, the current evidence is saying that it's no more than 14 units for men and women per week.
How much is that? 14 units?
Yeah, not much. It's interesting. People don't really understand what a unit is, but a small glass of wine would be 1 unit, and that's a small old 125 milliliter. Yeah, so 2 of those a day. But having said that, it's really, you have to be sort of cautious and mindful of drugs that you might be taking. If you have dementia, you may have some other medical problems. So it pays to be sensible, and again, as we mentioned, people with dementia at risk of falls. If you have too many, or you know it's affecting you after having your 2 units, then you know best to sort of steer clear.
And I've got 2 other things I wanted to ask you about. One is dark chocolate. I know there's supposed to be values to dark chocolate. I don't know what they are. And then what about? I've read things very pro and very con coffee. And caffeine. That coffee is really good for the brain, and then no, don't do too much coffee because well, I mean, nobody, you know, in theory, no one should do too much of anything. But are there benefits to coffee?
So I've not heard about the coffee. That's interesting. The dark chocolate, I'm not sure. Dark chocolate's very low in sugar. Sugar isn't brilliant for, you know. I'm not clear on that.
Okay.
I think, you know, basically you see lots written on the internet, read things. I think you always with the internet, use it with caution, but use it as a good research tool as well. And try and find the information from, you know, from good reputable sources is what I'd advise. And I tend to get a lot of my research from Dementia Research UK and the Alzheimer's Society because you know they're credible, trustworthy sources. I think you can read things and sort of think, oh, I need to take such and such supplements, and it may do more harm than good. And the other thing, you don't want to get people's hopes up unnecessarily. So, yeah, always look at the evidence.
Thank you. Question 3. My elderly mum, age 88, has recently been diagnosed with mild cognitive impairment, and I understand that this can be an early sign of dementia Alzheimer's within a few years. Mum is a widow living alone in a bungalow with her only known living relatives being myself, that's her next of kin, my married daughter who doesn't drive, and a male cousin living way up in Yorkshire whose wife is seriously ill, so he's not in a position to help at all. My daughter and I have thought that Mum's memory has been bad for a good few years now, but she's only very recently been given this official diagnosis. Do you have any advice on how I can help Mum cope with her diagnosis and live well and independently with her condition?
Yeah, good question. So there is this diagnosis, mild cognitive impairment. I've heard some doctors don't like the term in particular.
Why?
Some do. Some doctors find that it's not very helpful, that it can put people into more of a state of panic. Because I think it's important to say that mild cognitive impairment doesn't always convert into a dementia.
Okay.
So it's actually quite low. Alzheimer's Research UK is saying it's about 5 to 10% of people that get a diagnosis of MCI is what it's sometimes referred to, mild cognitive impairment, doesn't always convert to a dementia. So it's not always a useful diagnosis, though. For some, you know, maybe it's good to know, you know. I think the advice in this instance would be doing all the things that are recommended to try and keep your memory healthy, your cognition healthy, keep your body healthy. So those are all the things that we've started to talk about already. So things like good exercise, regular exercise, at least 2 or 3 times a week and a bit every day if you can manage it. Attention to a good diet. If you smoke, stop smoking. Full stop. If you smoke, just stop it. Smoking is just wrong and very harmful. If you drink, make sure you're drinking in sensible limits. If you're a little bit isolated, I don't know in this instance if the woman is isolated, keep active, keep going out, meet new friends if you can. There are lots of things available in Hackney. If you're interested in dementia-friendly swimming or dementia-friendly cycling, get involved in things like that. And puzzles as well, if you're spending some time on your own, be doing some puzzles and crosswords. But social isolation is thought to be a big risk factor. And mood as well. We haven't sort of made reference to mood, keeping a good sort of mental state. So if you're prone to anxiety or depression, keep a check on that as well, because depression can be a risk factor for dementia later on as well.
Well, what do you do at Homerton? So let's say somebody's got a new diagnosis of anything and they have to adjust to that and might be anxious about it.
Yeah.
How is somebody treated? What kinds of assistance do they get to accept and deal with this new diagnosis or a diagnosis?
Yeah, it's a really, really good question. So we have an amazing memory clinic in Hackney. It's operationally integrated. So it's essentially Homerton Hospital, mostly the mental health trust. Most diagnoses are made at the memory clinic at Falster Street in Hackney. And the model is very good there. So there's a lot of support once people get a diagnosis. So diagnosis is very thorough and would involve seeing a psychiatrist and possibly a geriatrician, so a doctor who specialises in older adults' medical conditions, possibly a psychologist, a scan as well. Once the diagnosis is made and the question is about help, then there are appointments offered after the session. There are memory clinic nurses, there's the Alzheimer's Society who might help with any other questions about sort of maybe thinking about the future and sort of planning. It's all done at an interval. It's important not to rush these things. It must be done in a way that suits the patient and suits the family and the carer. And then it's important to get carers plugged in, as we say, into essential services as well. So that would be things like the carer centre. At Homerton Hospital we run a carer support group every 2 weeks for carers of people with dementia, regardless of where they are in the hospital. And we have carers come in who the patient has left hospital and they come back into the group. There are community groups as well. It's important that the carer has maximum support as well.
Thank you. Question 4. My 85-year-old mother has just been diagnosed with Alzheimer's. She has always been a very bright and intelligent woman, and she is keen to understand more about her condition, which is great. She asked me for a book she could read to understand more about what to expect and how to cope. Can you recommend something appropriate? And you've got a pile of books here, a small pile.
I've got a small pile of books here, and I must stress that I don't work for any of these people, any of these organisations. But these are my go-to books that I've been doing my work for 20 years in Hackney, working in older adults' mental health. And more recently at the Homerton Hospital. But these are my go-to books when people have questions about dementia. I let them take them away with them and digest them. If there are any questions, we talk about that afterwards. The first one is can you see that okay? It's the Alzheimer's Society, and it's called the Memory Handbook. It's a practical guide to living with memory problems. So this might be useful for people who have things like the diagnosis of mild cognitive impairment, or you've recently had a diagnosis of dementia, maybe it's in the early stages. There's some good tips in there for looking after your memory. My other go-to book, this is a bit more of a big book.
It's substantial
compared to the others, but you know what? It's written in some very good chapters. And it's broken up into easy reads.
Dementia, the One-Stop Guide. June Andrews.
June Andrews. Now, Professor June Andrews is one of well, she's Scottish actually, she's one of the leading experts on dementia care. She works at Stirling University. She speaks all around the world. Stirling University are a centre of excellence in dementia care, dementia design, so thinking about environments, hospitals, homes, care homes. But she's written this amazing book about sort of all sorts of things, including what to do if the person with dementia has to go into hospital, which inevitably happens as people get older, may have other medical conditions. Chances are someone with dementia will end up in hospital. I recommend that one often. I often get asked by carers about their chances of getting dementia. There's a lot of focus on the person with dementia and supporting them, but carers are often worried about maybe they're going to get dementia as well.
Because of the genetic family thing?
They may think that, or just getting
whoever
old.
They are,
yeah,
the relation is.
Way more about it on TV and radio, and like I say, it's a very still sort of feared. And also a lot of what we do is try and break down the stigmas, but and give people the right information. But the other leaflet is from Alzheimer's Research UK, and that's about reducing your risk of dementia. And that covers a lot of things that we're talking about today, including things like diet, keeping active, exercise, having a good diet, keeping your weight down if you're overweight, keeping good cardiovascular health, and keeping connected socially. So getting involved in things in the community with your friends, neighbours, etc. So I always recommend that one. And again, it's written in a really easy to read format, really good publication.
And with that, with the Alzheimer's UK, this reducing your risk of dementia, and with the memory handbook from the Alzheimer's Society, am I guessing both of these would be available free somewhere?
They're both absolutely free.
Or is this one you need to go to a bookshop or online or something?
This one you need to pay for. Yes, but the other ones are free. I mean, the Alzheimer's Society and Alzheimer's Research UK are an amazing resource. So if you have access to a computer, you can go online, do look them up, because the resources they have are incredible. Everything from explaining dementia to children. So if we have a grandparent, say, who has dementia, and perhaps children don't understand, they have a really helpful leaflet on that. It just came to mind because that's something that came up this week for me in the hospital. All sorts of things. So I always, they're my go-to resource, the Alzheimer's Society. And
would they also have, are you able to call them? Because some places, like Age UK, you can call and talk to somebody.
Yeah.
For those who don't necessarily have easy access to a computer or just want to speak to somebody, because I find that sometimes that vocal connection is stronger than simply looking online.
Yeah, definitely.
Conversation
is so important, isn't it? Yeah, so definitely they are available. They have a pool of very good dementia advisory workers, so they're there to answer any question, no matter what it is. And however trivial or silly you think it is, it probably isn't. Someone will be able to answer it, but they are available. I don't know if we can put the numbers up at the end, or that would be.
There are amazing things that can happen in dementia discussions.
That would be really good. But yeah, they are, and they're very good at signposting and pointing people in the right direction. So, and it's for anyone affected by. I must stress, I don't work for them. It's for anyone affected by dementia. So you don't have to have dementia yourself, but you may know someone, a friend or a relative who has dementia, and you still like some questions answered. So, as I said at the beginning, the internet is full of things, full of therapies, but my advice is always go to organisations that have done the research, that's all evidence-based, to make the best.
Fifth question. What medications are most effective in preventing or delaying symptoms of dementia? Preventing or delaying? Are there medications? Because the medications you were mentioning before were once the diagnosis has happened, yes?
Exactly.
Take it away, Emma.
So the medications I mentioned before, once the diagnosis has happened. However, once you do have the diagnosis, you may still want some of those symptoms to stay at bay for as long as they can. So if you're worried about that, it really is worth talking to your GP. The drugs at the moment, they're most useful for, as I mentioned earlier, mostly for Alzheimer's disease. And the drugs I mentioned earlier, usually sort of in the mild to moderate stages. There is another drug that's used for later stages of Alzheimer's. It's something called memantine. We sometimes see this being prescribed when perhaps someone with dementia may be having some what they call behavioural and psychological problems in dementia. So maybe the patient is a bit more agitated than usual. Again, some people report some benefit from them and others nothing at all. It's not an exact science. Some people do report great things from them, but others not. So I forgot what the question is.
Oh, about a medication that might delay the onset or prevent or delay.
Yeah. So no. So like in terms of preventing dementia, can I make reference to this? So some research that's come out of University College London.
Of course you
Professor,
can.
Here I am.
Everything
Professor
is permissible
Jill
here.
Livingston and her team. This is very new research, or newish. Preventing dementia, 9 key risk factors. Now, this research is I think it was last year this was published. But it says 1 in 3 cases of dementia could be potentially prevented by targeting 9 risk factors. Okay, so those include continuing education. I'm reading it out because it's very, very far away from you. Continuing education in early life, reducing hearing loss in midlife, and stopping or reducing smoking. There are 3 of them. High blood pressure. So anyone with high blood pressure in sort of midlife, so people around sort of my age with high blood pressure, don't ignore it. Don't leave it if you know you have it. Try and get it sorted. It's not always a tablet that you need for high blood pressure, not always. Obesity, hearing loss in midlife, anyone who smokes, anyone with a history of depression, physical inactivity is thought to be a risk factor, so it's really important. Remember we said exercise, exercise, exercise. I think it's my mantra for today, isn't it? Anyone who's socially isolated, we've talked a little bit about that, and diabetes as well in later life. So I recommend that. So University College London, and that's Preventing Dementia, and that was headed up by Professor Jill Livingston and her team. So
I've adopted in my 60s, well I had it even before that my philosophy would be of living would be keep my body as articulate and active as possible, and my mind as alert as possible. So it's just keeping going and doing things.
Yeah. So Donald, you're on the right track.
I don't know. Maybe I think I am.
That's the best you can do. I mean, unfortunately, the reality is there's no cure for dementia. That is the reality. So, but the research is good. And if there are modifiable factors that we can play a part in, we can reduce those, then it goes a long way. But I think sounds like you're doing everything absolutely right.
But I mean, I only say it not to give the pat on the back, which I really appreciate, but just if that's of any use to anybody, just like do stuff. Move.
Get active. Move. If you have mobility problems, there are chair-based exercises that you can do. There are lots of, in City and Hackney, there are lots of groups. And apart from doing, the activities, the exercise, it's a good chance to meet other people. It's a good chance to network, meet other people.
And engage.
Which is so important.
Okay. Now, question 6. Excuse me, a vestige of a cold. My dad has dementia but is doing fine by most standards. He has some independence and some days can go out alone. He also does an afternoon volunteering at a local charity shop. He works in the back sorting stock, something he is very good at. The issue is my sister wants him to stop volunteering because she is worried that he is going to get lost one day whilst coming home from the shop. I think that it's important for Dad to keep on volunteering and have routine. Am I wrong in thinking this? And if I'm not, how should I explain this to my sister? So in family internal conflict.
Yeah,
what's
so
best
it's
for
not
Dad?
uncommon at all. I see this very, very regularly. It happens, doesn't it? Families, one daughter will think that something's a good idea and another daughter will think something different. It happens very frequently. I don't think everybody has the parents' best wishes genuinely at heart. But my advice in this situation would be that the father keeps on doing what he's doing. We know that it's really important when people have dementia that they maintain everything that they still can do. and we don't want people with dementia to become de-skilled. So with going out and sorting through stock is something that's doing, very well, and it's part of a routine. There's no way that I would recommend stopping that, because that's really important. I would also imagine that going out and working in a shop is a good point of social contact for this man as well. It's a chance to meet other people coming into the shop. I don't know if he's walking there, it's a way to get good exercise. All the things that we're saying are really good for someone with dementia. People always have differences of opinion, but I think it's important with dementia not to de-skill and really focus on the things that people with dementia can do well, and keep them going.
And keep them going, and maybe they're happy, maybe he's happy doing this.
Exactly.
My hunch is the other daughter has some anxiety about what would happen if.
Yeah.
It's that kind of thing.
Of course.
And I don't know what sort of safeguards would be in place, or if somebody occasionally goes to meet him from the shop, however he gets home. I mean, we don't know these details.
It's completely understandable, isn't it, to be worried about the what if he gets lost, what if he has an accident. I would say for that other daughter, maybe it might be a good idea to talk to a memory clinic nurse or a dementia nurse about, or an occupational therapist about the importance of maintaining all the things that you can do and routine. Everything is a risk balance, isn't it? What's the risk versus the benefit of something? So in this instance, I'd keep it going.
And with this gentleman who works in the shop, are there, this is just my innocence or ignorance, or whatever the word would be, are there cards or some sort of identification that say, if I am so-and-so and I live at, or how does that work with dementia? Are people issued that in case they do get lost, or is there anything set up, or is that not because of privacy?
Yeah, exactly. Well, I've known of families definitely doing that. So a little note in the pocket of the jacket.
The initiative.
This is my name and address. Should I get lost? There are GPS trackers. I can't remember what GPS stands for, but essentially, does anyone know?
Somebody out there will know.
GPS stand for, but essentially, sort of monitors that can tell someone who's sort of watching where that person is. It doesn't.
Geographical.
Maybe it's geographical.
I don't know. Anyway.
What is GPS? There's a question. Please write in. Yes, but I would think this is when dementia is sort of progressing a bit further, you might think about a tracking device to find someone if they're at risk of going missing.
Sure.
Yeah.
Okay. So how did you get into this? You said 20 years ago.
Yeah, it's a long time.
What drew you toward this field?
Yeah, it's a really good question. I don't know. So I've been nursing for about 23 years now, and then I used to work for St Mungo's, which is a homeless charity. But I've always had an interest in mental health, and I never thought I'd get involved in older people's mental health, but I did, and I've never looked back. I think it's a fascinating area to work in, and I feel very privileged to work in Hackney. I think it's a wonderful borough, despite the bad press sometimes. There's another side. It really is a wonderful borough. It's very diverse. I think we're very privileged to work here. And we work with some wonderful patients and some wonderful carers, and things do go right sometimes. So yeah.
Thank you for answering that. A bit of biography. 7. My mum has depression and anxiety in addition to her dementia. I was wondering, how common is this, and is there anything that I can do to help her feel better when she is having a bad spell? To my knowledge, she has never struggled with depression or anxiety in the past.
Right, okay.
So
That's another really good question. So when people get a diagnosis, it's a time when we do see levels of depression and anxiety rising. There's absolutely no surprise there. The stigma that goes along with dementia, the thought that it's a life-limiting condition can be really traumatic for people. Also, there's a sense, I suppose, that things in someone's mind, there's sort of a recognition that things aren't going well and things are deteriorating. It's no wonder that we see rates of depression and anxiety increase around diagnosis time. It's important if someone is expressing sort of anxiety, it's important not to dismiss that. That would be my first piece of advice. It's easy for some people to say, well, just brush it under the carpet, keep going, move on. I think feelings are very real, and it's really important to recognise people's feelings and validate them. I think that's really important. If that doesn't work and the symptoms persist, then it's really important to see a GP. There are some medications that can be helpful for people with depression, and there are lots of talking therapies as well. And community mental health teams are multidisciplinary teams, so that means there's lots of different professions in teams, and there are quite often psychologists in the teams who are very good at working with patients with anxiety and depression. So that's when it's got at its sort of a more serious stage. But initially, I really try and talk to the person and try and really sort of accept and understand the feelings around being anxious.
And I very much like that you said acknowledge, recognize, don't brush anything under a carpet. But once they're acknowledged, then there's what you do with them. And if there's a state or a condition that somebody has, and I know sometimes I've heard this, and I had one experience myself, that my local GP setting up some sort of mental health therapeutic thing it just took, well, in my case, the woman I saw never got back to me, and it was already a 2 or 3 month wait. So I think that's where this would just be my experience, that you need to be resourceful and find out about groups, find out about support groups, find out, ask, demand,
definitely
just make and take the initiative in order to help the person with dementia and possibly yourself as well, because that's it. Caring for somebody sets up a lot of anxiety and exhaustion, etc., etc.
Yeah, totally, it really does. Yeah.
So, and again, I'm not knocking the people, the experts, but you need to find them and
on that note, just something that's just so carers of people with dementia are also at high risk of depression and anxiety. And again, a study that I think was done by Jill Livingston, Professor Jill Livingston, was that carers of depression and anxiety are carers of people with dementia are much higher risk of getting depression and anxiety than carers of people with other conditions. So just on that note as well, I mean, again, the focus is on the patient, but actually the focus should equally be on the carer as well. Recognising if you're feeling down, recognising if you're struggling with coping, and identifying that early and getting the right help.
And really seeking it out, and
because
you deserve that help.
You deserve it, and like you said, bang on doors, be proactive, because you do deserve it. Yeah, so I'm sorry that's not a great experience for you, but you do have to knock on doors. But then I wish our NHS was better resourced, and I'm not going down that political.
No, and I'm not knocking at the NHS either, and I would like to give a little hurrah for City and Hackney Carers, because they provided a lot for me.
Oh, fantastic! Yeah, they are. Tremendous organisation.
So question 8. We are both in our mid-70s. My wife is suffering first signs of dementia. She has been tested and had an MRI which shows the beginning of vascular dementia. At the moment she asks the same questions, sometimes within 10 minutes of each other, and on the odd occasion she will put things in strange places. Other than that, she seems fine, still can cook a meal, but mainly just keeps dusting over and over again. I don't know how to help her. Will she get worse? Should I get a memory aid for her, like the MEM-X voice recorder, or will she think I am overreacting? Please help.
Oh, that sounds like a difficult in some respects. So it's not uncommon for repetitive behaviours, repetitive questions with someone with dementia. What I usually sort of say in cases like this is, if it's not a particular problem, then maybe it's okay that it happens. So, for example, if someone's just repeatedly dusting, maybe that's okay for the person with dementia. You know, maybe that's actually, maybe that's a bit therapeutic for them. If it's not, you know, we get this thing in hospital, you know, people sort of walking around the ward and, you know, maybe someone wants to put them back to bed. Actually, it might be better to let the person with dementia walk around the ward. Actually, you may do more harm by. So if it's not a problem, I think that's my answer, if it's not a problem for anyone, then why not let it happen? I think you may inflame the situation if you try and sort of stop that from happening and have someone sit still and do nothing. I've forgotten the second parts of the question, sorry.
Well, no, because there were quite a few at the very end.
Oh, the Memex.
Will she get worse? Should I get... I mean, you said that dementia doesn't... you can't cure it, but once it's there, you can find ways of handling it, minimizing it, coping with it.
And am I right? So this patient's still cooking. So do you remember what we said about maintaining skills? So if that's something that she enjoyed and she can still do, then why not? You know, it's better to carry on doing that than if you take it away, you take away someone's independent skills. You know, their dignity
word
as
agency,
well.
dignity,
You know?
agency.
Yeah, exactly. So the Memex, so I'm not familiar with that, but what I will say about there are occupational therapists who have, they can put in these door sensors essentially, so perhaps someone's at risk of going missing or going out. They can put these door sensors in and you can hear the voice of a familiar person say, go back inside or something. They're good for some people, but I have known of instances where they can make things worse. So the person with dementia will hear a familiar voice but not see the person there.
Where is that person?
Where is that person? And it might make them a bit more anxious. Well, where are they? I need to find them. So I think everyone with dementia is very different. So you just have to know what will be right for your family member or whoever you're looking after.
I read a novel, and I can't remember the title. I think it was quite a bestseller, and it had Elizabeth in the title, and it was about a woman who was trying to solve some sort of mystery.
Yeah.
And I remember there were things about Postit notes that she would do to remember to do certain things. So that's a different reminder than a vocal reminder that comes out of the ether.
Yeah.
Is Postit notes or just any kind of notes a thing?
Post-it notes are wonderful. Yes, Post-it notes, signs on kitchen cupboards reminding people of this is where, you know, the salt and pepper is or whatever. And if things go missing in a house, you know, because sometimes people pick something up and put it somewhere for safekeeping. Maybe it's a good idea just to keep everything together, you know, keys, glasses, wallet, keep them all together in one place. And, you know, sort of all go back into the same place as well. Memory aids are very good, reminders are very good, so Post-it notes are excellent. But with the voice recordings, I'm sorry, I don't know what a Memex is, but just I know from occupational therapy equipment, mixed feedback on how helpful that is.
It might work, it might not for this person.
Yeah, exactly. It really just depends
if it's
on the person.
implemented. And I would say that like with the repeated questions, that this gentleman, you know, just be really patient and answer and maybe not, I don't know, maybe not feel distressed by the repeated questions if possible, but just be enjoy being together.
Enjoy being together, and also, you know, if it does become too much for the carer, then, you know, maybe think about accessing some through the local memory clinic, some support to help sort of think about strategies to manage that. So if it's winding you up, you know, which it can do, asking someone ask you the same question over and over, talk to someone who can, you know, go through some strategies with you to help you manage that, because we don't want it to get to breaking point. So again, just thinking about risk and benefits, you know, so we don't want to stop the things that people can still do. So it's important that this woman still does her cooking and, you know, is getting some benefit from dusting. You know, if it's keeping her distress at bay, then why not? But then if it's annoying for the person that they're living with, then that person, you know, get some strategies to help manage that when they're feeling like that. And that can be lots of different things. It might be, you know, having, I don't know what supports this person has. Maybe they can get someone to sort of be with the cared for a bit, or some respite from time to time. You know, going out together, having a change of scene.
Yeah.
Maybe doing some exercise together. Here I go again. You know?
Exercise.
Yeah.
What I so enjoy about doing these dementia discussions, just to editorialize, is I some of them are quite poignant, and I feel a lot of empathy, and I'm trying to put myself in that situation.
Yeah.
And what would I do? And anyway, thanks for sending those questions in.
Yeah,
folks.
brilliant.
Number 9, I've noticed that my mom's dementia symptoms, including confusion, irritability, concentration, and depth perception, tend to get worse when she's feeling stressed out. Are there any tragedies? I almost said tragedy. Are there any strategies that I can employ or things that I can do to help my mom de-stress and keep her more emotionally stable? So strategies for de-stressing.
So Donald, guess what I'm going to say?
Exercise. 2 times or maybe 4?
Yes. So again, you cannot, you know, the value of exercise is so important. You know, it's a really good way to de-stress. Again, if you can't, you know, if mobility is a problem, there are other exercise forms you can do. Hackney offers some wonderful dementia-friendly swimming. So for those with mobility problems, it may be an option to do that. Dementia-friendly cycling. Again, going out as a point of social contact, so that may relieve stress as well, just by meeting other people.
As you said, changing the scenery. Changing
the scenery, exactly. But there's other things that can help as well, you know, keeping a good mental state, so keep in check on things like your mood, because if you are predisposed to things like depression, or you're getting depression, then it may be that the small things that may not have affected you may now start to affect you and make you feel stressed. So keeping your mood in check, and if it is a problem, you know, then seeing a GP about that and sort of going through the options after that. And exercise as well. I've said that, haven't I? Yes. You have to do massive editing on the number of times I've said exercise.
We'll do a workout. How many times did Emma say exercise today?
Exactly.
Right. So we are now at number 10, our final question. Hello. My dad, aged 81, has recently been diagnosed with Alzheimer's disease and has been offered medication. I'm not exactly sure which one. I think it's donepezil?
Okay.
Did I say that correctly?
Yeah.
Okay. Thank you. He has been told that if he has this, he will have to stop drinking alcohol. Whilst not being a heavy drinker, he does enjoy a G&T at 5 p.m. each day and has decided that he prefers to continue with this and not take the offer of treatment. Is it worth me perusing alternative options? Are there any medications you can take with alcohol? I'm not sure what to recommend to him, as not sure what benefits the tablets will bring, but he really enjoys his G&T.
Yeah. Again, here we go with another one of those
choices,
risk versus, you know, benefits. So the recommendations are that people don't drink alcohol with this particular type of drug, because it can affect the way that the drug works. Having said that, as we mentioned earlier, donepezil is one of these drugs that can be prescribed in people with dementia, and not all people will gain effect from it. Some will, some won't.
What does it do? Do you know?
Yeah,
say a little bit about what it does?
Yeah, so it's a cholinesterase inhibitor. So acetylcholine is a neurotransmitter, so a chemical that sends messages between brain cells, and this chemical can reduce in people with Alzheimer's disease. So it's an important drug. Like I say, it works in some people and not others. But we know that when people have a drink, it can affect the way it works, so it may stop it working.
Can or always?
Well, the recommendation is not to have it, yes. So again, I mean, the other thing to say about alcohol is that I don't know what this chap is. He may be taking other medications, there may be an indication taking other alcohol with other meds that he's on. If he's not on anything else, and the gin and tonic is really important at 5 o'clock, well then maybe that's the more important thing to take. Bearing in mind that alcohol can make you a bit more blurry. It's processed, it takes a longer time to sort of process as we get older. So less alcohol affects you more than perhaps when you were younger. So, but if it's something that someone's done historically all their life, have their 5 o'clock gin and tonic. The other thing is, there are now on the market, and I don't work for any of these companies either, there are really good non-alcoholic spirits. I had one last night actually, and I funnily enough, and it coincidentally rather, and you can't tell the difference from a gin and tonic, and there was not a drop of alcohol in it.
What was it?
Seed lip.
Okay.
I don't know if anyone's heard of that. I don't work for the company.
Was it a substitute for anything in particular, or just have a seed lip cocktail, please?
Yeah, it was a seed lip. It looks like gin. You pour it from a bottle that looks like a gin bottle, and I had it with a small tonic, and it was really nice.
Well,
there's not a drop of alcohol in it.
It might work. And does it? So it has a similar taste.
It has a really similar taste.
Well, perhaps this is a solution.
So it might be a switch to try that. Say, hey Dad, why don't you try this gin and tonic tonight? It looks exactly the same in the bottle. Yeah. Having said that, we don't like to dupe people into, it's good to tell people they're having, but it might be good as a choice. Why don't you try this? Then we're quite safe with the donepezil. But bear in mind with alcohol, just think about other tablets that people might be taking that may have an effect as well. And alcohol can increase your risk of having a fall. You don't want people to fall. Falls can end up with people being in hospital for extended stays. So, bear all that in mind.
Well, what a good way to end. And yes, we've it's not that we've run out of time, but we've reached the end of our time together. And and you've been a wonderful expert, Emma. So
thank you. It's been really good doing this. Thank you everyone for having me. I've really enjoyed it. Thanks, Donald.
And we'll be back on December 23rd, just before the big blowout holiday. So join us then and pass this on to others if you feel they may benefit, and be in touch. And thanks for watching. So long.
Bye.